Tinnitus, or ringing in the ears, is a big problem. And in this video, I want to share the new program that I'm launching that I've been working on over the last 2 years. Let me share some of the problems with tinnitus. Number one is that it can completely turn someone's life upside down. There's various causes of tinnitus, but for most people, when it gets into the moderate or severe range, this becomes the hardest health problem that we've dealt with. Okay? It's a constant, persistent noise. It's very hard to fall asleep. Trying to work during the day in a quiet environment like your home office becomes very challenging. To concentrate, to keep your mind focused on something that's not the sound in the head is very challenging. Second problem here is that it's hard to find experts who can help you with this. It's unfortunately, and I empathize, it's so common for our patients to go into their primary care physician and say, hey, I'm hearing some ringing in the ears. What can I do? They're often referred to an ENT doctor. And when they go to that ENT, the medical doctor for ears, they're left very disappointed. They're told things like, there's not much you can do. And I'm sorry you have tinnitus or tinnitus. What I recommend you doing is just waiting a few months, seeing this gets better on its own, or just learn how to deal with it, learn to manage it. That's a sort of dead end and a real issue. The third problem here is that there's rarely a comprehensive program that's available for someone that takes the best practice, the evidence, the science, and puts it together in a manner that gets people the best results. Because what I see is that people are trying different things. Oh, they might try sound therapy a little bit for tinnitus. They may have tried some herbal supplements online. They may have tried bimodal stimulation. They may have tried hearing aids. They may have tried therapy and counseling. All these pieces together can move the needle and help a bit. But what's missing is a comprehensive program, a protocol to follow. The fourth problem I see for people looking for a solution for tinnitus is that many existing programs don't have a guarantee associated with them. So it's very hard to spend your time and energy or money on a program or a treatment that's not guaranteed to work. All of this is leading up to the Tinnitus 180 program, which I've been thinking about over the last few years, taking these problems that I've just discussed and working with our team of experts at Treble Health to determine what can we do about this, right? One of our core values is innovation and empathy. It's so challenging what people are going through with tinnitus. It's an invisible condition that most other people can't even see, let alone understand. But when you have doctors who specialize in this, we get it. And I know some of you are going through really challenging times. Regardless, the main message here is that there is hope. All right? There is hope. There is something you can do to turn your life around. And the results are quite positive in terms of what benefits patients can get. So that's why we created the name Tinnitus 180, to turn your life around 180 degrees through tinnitus treatment. And our philosophy for the Tinnitus 180 program breaks down into 3 core pillars. The first is called Root Cause ID. The second is called Smart Sound Devices. And the third is the Brain Retraining Program. Let's quickly walk through those. Root Cause ID. In order to properly treat tinnitus, we must address it at the level of the root cause. Tinnitus, ringing in the ears, buzzing, hissing, noises in the head, it is a symptom. It is not a condition in and of itself. So we have to find the underlying disorder, and we use the Root Cause ID system within our program to do so, and then individualize the treatment based on the cause of what is going on with your ears. A mistake people make is thinking that their tinnitus is only caused by hearing loss. That's not true. There are many other causes that are often mis- or underdiagnosed. The second pillar here, smart sound devices. The evidence is clear that using sound therapy is one of the best treatment options for tinnitus. So we combine sound therapy devices that are worn on the ears, as well as personalized programming of how the sound enters your auditory system, mixing in with tinnitus in the auditory brain, and help retraining the tinnitus over time to reduce the perception and often the volume during the treatment period. The third pillar, the brain retraining program, uses the existing evidence found with cognitive behavioral therapy and tinnitus retraining therapy towards understanding that tinnitus is not just in the ear and it's not just in the auditory brain. It's related through these neuron networks to the limbic system, which is the emotional regulation of the brain, which looks at the fight or flight response and fear or anxiety or stress related to the sound. Unfortunately, all of those conditions, when those are hyperactive, they can make tinnitus worse and make it harder to reduce the sound. Bringing those three pillars into the Tinnitus 180 program is something that made so much sense. And I put a lot of thought into this, working alongside my team, other doctors who specialize in tinnitus. In addition to those pillars, an important piece of this is our data showed that 85% of patients going through this protocol within our system at Treble Health had a successful treatment and were able to significantly reduce their tinnitus. And that's all well and good, but how do we showcase that there is something that can be done for the thousands of people out there that need help, who have already been told by their ENT doctor there's nothing they can do? And when someone who's a professional who seems to have the best interest in mind tells you that there's nothing you can do or there's not much to do for tinnitus, then it can be very hard to educate someone into believing that there is something to be done. So because of that, we created the Tinnitus 180 guarantee. And this is very innovative in my opinion, because what the guarantee is, it says that we will provide a significant reduction for your tinnitus within 180 days, or you get your money back. There is the reality that not every person who starts tinnitus treatment gets better. And we own that, we lean into that. But that's not your fault, or that's not the patient's fault if they're showing up to their appointments, they're using their sound therapy devices, they're doing their exercises as a part of the brain retraining program. If tinnitus doesn't get better significantly for that patient, then we don't want them to have to pay for the program. And we want to take that risk off the table. So that's something that I'm very excited to introduce. And through the last months that we've launched this program, the results have been very positive, and I really hope that this 180 guarantee gets people to not only believe there's something they can do for tinnitus, but to make it a decision or to help them with their process where they're not stuck in the, oh, this might not work for me, therefore I'm not going to try it, which I totally understand where you're coming from in that. I do want to share a little more detail about some success stories of individuals who've worked with this type of protocol that we've laid out here with the Tinnitus 180 program. The first piece of this is Lewis. Lewis is a middle-aged man who lives in Oregon. Lewis went to local doctors and was told there wasn't much he could do for tinnitus. Fortunately, he found our team through a YouTube video. Lewis needed a lot of help. His sleep was a disaster. His energy during the day was not good. He really struggled to do his work, and it was hard for him to take care of his family. Fortunately, after working with us, he was able to reduce his tinnitus, and he found relief within 6 days, mostly using the sound therapy devices, which provided that immediate level of relief here within a week. And he eventually graduated from the Tinnitus 180 program, as it's now named. He graduated from Treble Health from working with a doctor on our team specializing in tinnitus and getting these sound therapy devices sent to his home and custom programmed for him. And he graduated in 116 days. Not only does this show that there's something you can do for tinnitus, but it starts to paint the picture of, in the first days, you're likely to notice benefits from using the technology, the tools that we can send to you. And the second piece is that it shows that tinnitus is not a quick fix. And I understand and I empathize why someone would want a quick fix. My goodness, this is such a persistent and challenging condition. You might be thinking, I just want it to go away as quickly as possible. I just want it gone. But when I can help you reframe this and look at some other possibilities here that might be just what you need to get your life back in order, to turn things around for you. Lewis's story explained that he graduated, from our program essentially around the 4-month mark. So he was consistent. He showed up to his appointments every 2 weeks. He used his sound therapy daily, and he committed to the brain retraining program. 4 months in, his tinnitus is mild, doesn't bother him much, and the volume perception is significantly less. So what does this mean for you? It means that if you have the right perspective, if you have the right program in place, you have a very good chance at reducing tinnitus. And if you consider, well, what happens if it doesn't work for me? If you try a tinnitus treatment, make sure there is some form of a guarantee or a risk-free trial with it, so that if it doesn't work for you, you know that you're in good hands and you're safe. My name is Dr. Ben Thompson, founder of Treble Health. I've been so focused and dedicated on providing online videos, materials, resources, and appointments, tinnitus treatment via telehealth for the tinnitus community here. Since I started doing this work, about 10 years ago, it has been my big passion to help people with tinnitus. I myself have a mild degree of tinnitus. Fortunately, it's never been a severe problem for me. There's periods of time where it's louder and more bothersome. There's periods of time where I barely hear it. My tinnitus started from loud noise exposure after going to concerts and music festivals back in my youth. And now my tinnitus is very well managed. The audiologists, the tinnitus doctors on our team, about half of them have gone through a serious degree of tinnitus, and they've used the same methods that they use with our patients to get the results of tinnitus reduction. So all of that to say, we really understand where you're coming from, and I'd love to hear from you. I'd love to hear what's going on for you at an emotional level. What is your day-to-day like for tinnitus? Where do you struggle? We do answer your questions here, so go into the chat and let me know if you have any questions. I will answer them either on a video or in the comments. Now, if you need help for tinnitus, a great place to go to get started with the Tinnitus 180 program would be scheduling a free consultation with our team. We have a specialist standing by. You can schedule a time with them. We're going to walk through some details of what we cover. We can understand you, where you're coming from, get some clues as to what is the root cause of your tinnitus. Maybe you've tried some previous treatments with mixed success. What kind of sound do you hear? How does it affect your life? Does it affect sleep? Does it affect work? Does it affect hearing, conversations? All of that is very important to provide next steps and a potential solution. So click the link right there if you'd like to book a free call. If you'd like to have a consultation with a member of our team, we're here to help. I want to express my gratitude and my thanks to everyone here in the Treble Health community, in the tinnitus community, my amazing team that I work alongside to make videos like this possible, and the Tinnitus 180 program. My hope, my dream is that it helps thousands of people. My life has already been changed by becoming a tinnitus specialist, and by starting Treble Health, I want to continue to change the lives of people who need help for tinnitus and are looking for an expert to reduce this sound. I hope to see you soon. Thanks so much for watching.